Thank you, Senator Chandler. Senator Scarr.
Madam Deputy President, it's with great honour that I rise today to speak in response to the Governor's address. And I think at the outset we should reflect, as the Governor-General does in his address, that this country has very strong foundations. We're in our 28th year of consecutive economic growth. We have a strong social security safety net, universal health care, a strong comprehensive education system, and on 18 May earlier this year, all Australians came together peacefully at the ballot box and cast their votes in a democratic election. We are one of the longest ever continuous democracies on the face of the planet. So we should reflect on those strengths in our society as we consider the Governor-General's address. And one of the themes coming through the Governor-General's address is the cohesive plan that this government has for this country's future over the next 3 years. The government's agenda is predicated on empowering the people of this country, empowering their aspirations, empowering their inherent entrepreneurial spirit, empowering them to make decisions which are in their best interests and the best interests of their families. I would like to make some responses to some of the previous speakers. Senator Stewart did refer to the government's initiative with respect to the cashless welfare debit card. I think there is no question that the senator comes to this debate with great passion and great empathy for people who are doing it tough in our society. But I must respectfully say, Madam Deputy President, I do disagree with some of the assertions that were made in that address. In particular, as I referred in the debates previous on this subject, in particular last week, the member for Hinkler, Mr Keith Pitt, has drawn attention to the fact that he has seen a very positive response to the implementation of the cashless welfare debit card in his seat of Hinkler. And over the course of the last 12 months, we have seen the rate of youth unemployment in the seat of Hinkler, in the wider area of Wide Bay, fall from 27.6% in June 2018 to 18.4% in June 2019, a fall of 9.2%. Quite an astounding result. And when you look at the comparative falls or increases in youth unemployment across Queensland, Wide Bay is a standout. Wide Bay is a standout. So there is some positive evidence. There is some positive evidence with respect to the results of the introduction of the cashless welfare debit card. And I would have thought that everyone in this place, everyone simply wants to see those young people who currently don't have the opportunity to engage and have the benefit of dignity of work. All of us want to see those young people get a chance to break through to the workforce and be everything they can possibly be. I'd also like to make some comments with respect to Senator Abetsa's contribution in this place. I could not agree more. That the coal mining industry is an integral industry to my home state of Queensland, and Queenslanders at the last federal election sent an unequivocal message to this place that they understand the importance of that industry to my home state of Queensland. Thousands of jobs, billions of dollars of royalty and opportunities for small businesses and large businesses across my state presented by the coal mining industry and more generally by the resources industry in my home state of Queensland. I would like to, Madam Deputy President, touch on the issue of mental health in particular in my response to the Governor-General's address. It would be 26 years ago that, as a member of the Queensland Young Liberals, I wrote a policy paper which was adopted at a Young Liberal National Convention entitled 230,000 Lost Years, the Scourge of Youth Suicide. And here we are 26 years later, still grappling with this extraordinarily difficult issue. And it does give me a lot of hope. It does give me a lot of hope that everyone sitting in this Senate chamber, all sides, understand the importance of us as a federal parliament addressing this issue. I think one of the highlights for me out of the federal election campaign was in one of the debates between the leaders, each of the leaders, the Prime Minister and the opposition leader, were asked, "Can you tell us one thing about the other which you actually admire? What is something which you would compliment the other leader, your opponent, with respect to how they've conducted themselves with respect to their beliefs? And the opposition leader, the then opposition leader, complimented the Prime Minister with respect to his passion addressing the issue of youth suicide. So there certainly is a spirit of bipartisanship, a spirit that extends across all parties with respect to attempting to address this issue of youth suicide, which is addressed in the Governor-General's address. Over a 5-year period from 2013 to 2017, the average number of suicide deaths in this country per year was 2,918. Queensland recorded the largest increase in suicide deaths, 804 in 2017, compared with 674 in 2016. And when you look at the figures from 2017 with respect to youth suicide, they make for sobering reading indeed. In 2017, there were 16 suicides between the ages of 0 and 14. 16. 106 between the ages of 15 and 19. 195 between the ages of 20 and 24. A total of 2,348 male suicides. In relation to females, women, 8 suicides in 2017 between the ages of newlyborns and 14. Hard to comprehend that, 8. 50 between the ages of 15 and 19, 53 between the ages of 20 and 24, a total of 780. A total number of suicides in this country in 2017 of 3,128. And it's not just a question of the young people who took their own lives, it's also an issue with respect to those people who are left behind, parents who are left grieving and considering whether or not they are guilty in some way with respect to what has happened to their children, friends asking themselves could they have taken additional steps in order to look after their loved ones, to step in and try and prevent the tragedy that occurred. So it's extraordinarily important, Madam Deputy President, that we have this discussion with respect to suicide generally and youth suicide in particular. It's also been noted that there is a particular issue with respect to the rates of suicide in our Aboriginal and Torres Strait Islander people. In 2017, the rate of Aboriginal and Torres Strait Islander suicide was twice that for non-Indigenous people. And suicide accounts for 40% of all deaths of Indigenous children. One life lost to suicide is one too many. The government last week announced it is investing $4.5 million in the Proud Spirit Australia program to deliver a national plan for culturally appropriate care and make suicide prevention services available and accessible to First Australians, no matter where they live. In addition, the government's investing $963,000 to establish the Centre of Aboriginal and Torres Strait Islander Lived Experience Mental Illness and Suicide Network, the Black Dog Institute and the Centre of Best Practice in Aboriginal and Torres Strait Islander Suicide Prevention at the University of Western Australia will work together to deliver this initiative. But it's not just about government. I think it's about each and every one of us reflecting upon what we can do as individuals to address this scourge of youth suicide. William Styron is a well-known author who famously wrote the book Sophie's Choice. And after someone who he admired a great deal committed suicide, he actually went public in a beautifully written memoir called Darkness Visible, a memoir of madness, where he spoke about his own experiences dealing with depression. And I want to read some excerpts from that book today. The pain of severe depression is quite unimaginable to those who have not suffered it, and it kills in many instances because its anguish can no longer be borne. The prevention of many suicides will continue to be hindered until there is a general awareness of the nature of this pain. And it's incumbent on each and every one of us to reflect on that, to try and understand when we have colleagues, friends and family who are battling with depression to understand the pain they're going through and provide as much support to them as possible. We are still battling a stigma in our society. Styron wrote, talking about his own experience with depression, "So the decision-making of daily life involves not, as in normal affairs, shifting from one annoying situation to another less annoying, or from discomfort to relative comfort, or from boredom to activity, but moving from pain to pain. One does not abandon, even briefly, one's bed of nails, but is attached to it wherever one goes. And this results in a striking experience, one which I have called, borrowing military terminology, the situation of the walking wounded. For in virtually any other serious sickness, a patient who felt similar devastation would be lying flat in bed, possibly sedated and hooked up to the tubes and wires of life support systems, but at the very least in a posture of repose and in an isolated setting. His invalidism would be necessary, unquestioned and honourably attained. However, the sufferer from depression has no such option and therefore finds himself, like a walking casualty of war, thrust into the most intolerable social and family situations. There he must, despite the anguish devouring his brain, present a face approximating the one that is associated with ordinary events and companionship. He must try to utter small talk and be responsive to questions and knowingly nod and frown and, God help him, even smile. But it is a fierce trial attempting to speak a few simple words." That's William Styron recounting his battle with depression, which he bravely wrote about in his memoir, A Memoir of Madness. And it's important, Madam Deputy President, that we all consider those words and consider what empathy and understanding we can give to people who are suffering from depression. And it's also important that once people have gone through that journey and are on the road to recovery, once they've overcome that stigma of whether or not they should report their illness to a doctor, once they've gotten that help, it's also important that we assist those to come back in to the general workings of our society, in our workplaces, social engagements, etc., and understand that they may well need ongoing treatment in order to minimise the risk that they might add to those suicide statistics I read out earlier today. And in this regard, I'd like to quote from Andrew Solomon, who wrote a book called The Noonday Demon, an atlas of depression. Again, a depression sufferer who went public to try and increase understanding of what it is like to suffer from depression. I quote, "Since I'm writing a book about depression, I'm often asked in social situations to describe my own experiences, and I usually end by saying that I am on medication. Still, people ask, but you seem fine. To which I invariably reply that I seem fine because I am fine, and that I am fine in part because of medication. So how long do you expect to go on taking this stuff, people ask. When I say that I will be on medication indefinitely, people who have dealt calmly and sympathetically with the news of suicide attempts, catatonia, missed years of work, significant loss of body weight and so on, stare at me with alarm. But it's really bad to be on medicine that way, they say. Surely now you are strong enough to be able to phase out some of these drugs. If you say to them that this is like phasing the carburettor out of your car or the buttresses out of Notre Dame, they laugh. So maybe you'll stay on a really low maintenance dose, they ask. You explain that the level of medication you take was chosen because it normalises the systems that can go haywire, and that a low dose of medication would be like removing half of your carburettor. You add that you have experienced almost no side effects from the medication you are taking and that there is no evidence of negative effects of long-term medication. You say that you say that you really don't want to get sick again, but wellness is still in this area associated not with achieving control of your problem, but with discontinuation of medication. Well, I sure hope you get off it sometime soon, they say. And I think, Madam Deputy President, there's a lesson there that as people who have potentially dealt with attempted suicide attempts, they have gotten help, they are on the road to recovery, that there needs to be understanding that that road to recovery may require treatment over a long period of time. So I'm proud to be part of a government which is building a mental health system that is integrated, simplified, trusted and comprehensive, increasing mental health funding to $4.8 billion this year, New funding for community mental health and mental health research, assistance to prevent suicide, telehealth access for psychological services in regional areas, and support for current and former ADF personnel. Funding of an additional 30 Headspaces services by 2020, including in my home state of Queensland, and new specialist residential facilities for eating disorders. The government's $503.1 million youth mental health and suicide prevention plan is the largest suicide prevention strategy plan in Australia's history, and it's one which we should all be proud of as we seek to introduce measures in order to address the scourge of youth suicide and suicide more generally. And, Madam Deputy President, it is part of an overall plan which is dealt with in the Governor-General's address to this place, including with respect to the economy, trade, education, health, environment, the Pacific Step-Up Plan, which I referred to in my maiden speech last week, all part of a coherent, integrated plan which I consider to be one which is in the best interests of my home state of Queensland. In performing my duties over the course of the next 6 years, I take very seriously my obligation to deliver that plan for the people of Queensland, because that is indeed what they voted for on the 18th of May earlier this year.